Next, we're going to talk about diagnostics used for things that affect the heart. So cardiac diagnostics. An electrocardiogram is known as an ECG or an EKG. Basically, as we learned in the cardiovascular system, the heart is made up of a muscle that needs electrical impulses to initiate the contraction. The electrocardiogram's purpose is to monitor how the electrical impulse travels through the heart. The procedure is to attach electrical wires or leads to the body, the torso, the trunk of the body, and the wires will detect any electrical activity in the heart. The electrical activity is converted to a visual image, and the image can be seen on an EKG monitor or tracing on a strip of paper. We can also use a Holter monitor. The purpose of this is to record all cardiac activity, usually during a 24-hour period or longer. The procedure is the monitor attaches to a belt or shoulder strap, and it utilizes the ECG leads. The patient keeps a written diary that involves their activities plus time of the activities that they did throughout their day. And then the doctor or clinician will compare the activities to the tracings to provide a monitor to determine cardiac pathology. They're going to look at, if they were out exercising, did the heart rate increase? Or if they were just sitting home watching TV on the couch, did their heart rate increase? Kind of thing. Another type of diagnostic testing associated with the cardiovascular system is stress testing. The purpose of a stress test is to identify early heart disease by inducing physical exertion in a controlled environment. In early heart disease, the patient may exhibit symptoms such as chest pain or discomfort, shortness of breath, or lightheadedness during physical exertion. The procedure is to have the patient walk on a treadmill at different speeds and inclines over a period of time. If they are unable to walk, then they give them a medication through an injection that causes a rapid heartbeat, which would mimic the exercise. The electrocardiogram and blood pressure will be monitored during a stress test. In some cases, they will use a radioactive dye injected into the bloodstream and will follow that through a monitor. Decreased blood flow through the cardiac muscle can indicate a clogged cardiac artery and may need to be opened or replaced. So next, we're going to talk about scopes. So scopes are a instrument that allows the practitioner to visualize and see what's going on. So we use these scopes in different procedures. And the first procedure is an endoscopy. And this is a procedure where the lit tubular device usually has a magnifying lens, is inserted into a region of the body to obtain a better view. Different types of endoscopes include an otoscope, and that's used to examine the external ear canal and the eardrum. Otoscopy is a painless procedure if it's done correctly. You probably remember going to the doctor's office and they look in your ears with that little lighted scope. It doesn't hurt. That would be an otoscope. A bronchoscope, it has a magnifying lens and a tube the thickness of about a pencil, and it goes down into your bronchioles. Several channels within the tube provide for a light source, installation of fluids, suctioning of the airway secretions and fluids, and then also little forceps in case it needs to take a small tissue sample. It can be an uncomfortable procedure, and generally they will give the patient some medication to help with that discomfort. A gastroscope is used to examine the interior of the stomach, also sometimes referred to as an upper GI scope. It's uncomfortable. They put a scope down through the patient's throat, and usually they will give the patient a sedative so that they will be asleep while this procedure is going on. A laparoscope is used to examine the abdominal region. It allows for a much smaller incision and quicker patient recovery. A laparoscopic surgery can occur. The surgical procedure, it requires a high level of sedation and anesthesia. We use that sometimes to remove the appendix. A colonoscopy is a visual examination of the colon. It's used to determine if there's growths or tumors, if there's if there's bleeding, where the source of that bleeding is located, and that will generally use a mild sedative to make the patient more comfortable. Here we have a cystoscope, which is illustrating looking into the bladder. So that would go through the urethra.